Hello guys, welcome back. This is another episode of the Mind Talk Show. My name is Lynn. I am a mental wellness coach. Your mental health matters. In today's video, I want to talk about substance use disorder, or you may call it drug addiction. We need to understand why do people take drugs? Why are they addicted? What are some of the symptoms? What are some of the causes? What are the predisposing factors, the risk factors that can make you end up being addicted? I want to start from the risk factors. What makes you take drugs? What is the surrounding? What is there? What is this that can make one end up taking substance? Now, we have family history addiction. You have ever heard of the family that is called that so and so family is a family of drunkards? And we take it that way because we don't know. One person started, maybe the forefathers, maybe the, grandparents started. It moves down to our fathers, then now we are the one who are taking it. So family history can make one to be at a very high risk. Okay, another thing is peer pressure. Our children who are teens, who are maybe in school, adolescents, they are being lured into taking alcohol or taking drugs because of the peer pressure. Your friend is taking it, so you start. In fact, according to the research, many people start at their teenage to take these drugs. They start at their teenage. The reason is they are influenced by each other. I am taking it. It makes me feel this and that, whatever reasons they give. So you want to try so that you can also feel the same way as the other person. So peer pressure is a very, very high, it's a very good risk factor. Another thing is lack of family involvement. You are a parent, you're a mother, you're a father. You don't know how your children are faring on. You don't even know their academics progress. You don't go to schools. You don't ask their progress. You are less concerned. You're a working mom. You're a working dad. So your work is to go to work, provide for the basic needs. The rest, watajipanga. It is so wrong because you're giving them an avenue. You're giving them a tunnel to start doing drugs. Even when they start, you usually don't know. You wait until it is too late for you to do something. Okay. There is early use. There are these families who used to brew. That's called changa or busa or any other alcohol. You know what? Children see people taking it. Yes, as much as it is a resource, it is something that maybe brings money, finances, so that other people can go to school. Children can start taking these drugs at that early age. And you know what? It interferes with their development, brain development. And once that happens, you will not help these children. Okay? So that early use, maybe your father was a smoker, so he used to send you for a cigarette from the shop. So along the way, when he finishes sniffing, you will have to take it and smoke it. So this is how children learn. Remember, children mirrors parents. Everything you do, children see and they mirror it. And they want to do exactly the same as what you're doing. So if you're drinking alcohol, the children are seeing you're drinking alcohol, you're coming, you're abusing their mother. If it's a father, you're coming there doing funny things. Children will be interested. They will think, this is the way to go. This is a way to run my family. So when they grow up, don't regret, because they will follow your steps. Basically, they will follow your steps. There are these people who are taking high addictive drugs. Example, stimulants, cocaine, even painkillers are listed here. You're having headache, your first step, instead of even doing something like maybe taking a lot of water, having a rest, you're taking a painkiller. Every now and then, painkiller. Every now and then, you are becoming addicted. And once you're addicted, you will not stay without it. You will feel like taking it all the time, every other time. Okay? Now, how do you recognize unhealthy drug use in a family? You are a family. How will you tell that your child is taking alcohol or your child is into drugs? How will you detect? How will you know? Because I want to teach you this so that you can follow up with your children. You will know. Number one, problems at school or at work. If it's a person, if it's your hubby, if it's your spouse, you will know. Because now they will maybe miss some important meetings. They will miss some important curriculum. If it is school, they will miss classes. You will know. You will be called by the teachers and be told your child does not enter class. You will assess from there what could be the reason. Go find out. Don't assume things. Physical health issues. Lack of energy. These people, they don't have energy. They lack energy completely. They are done. They are tired all the time. Okay, their eyes are red. There are physical symptoms that you can tell, that you can see from a person, and you're like, why are you so tired? Why is your mouth so red? Why are your eyes so red? Did you cry? What is happening? You will need to find out what is happening. Another thing is neglected appearances. Lack of interest. These people were very active in one way or another in daily activities. Now they don't want to appear in anything. They don't want people to see them. If they are teenagers, they will restrict you parents from entering their room, because they know if you enter their room, you will find out what is going on, and this is dangerous to them. Okay, you will maybe either find them smoking, you will find those drugs, cocaine and all that. So they will not want you to enter their room. They will restrict you as a parent. And once this thing has started, and remember, earlier you were free to enter their room and do whatever, but now you're restricted. You will start asking yourself questions. Now there will be money issues. These people will be thieves. You put money somewhere and it's gone. It's gone. You will know. Or they are asking extra money, like, or oftenly, Mom, I don't have this and this. Dad, I don't have this and this. Try to find out why they want that kind of money. There has to be something that is making them to borrow that money. I want us to look at the symptoms of recent use. There are people who have used drugs recently, like even yesterday but one. How do they look like? They will feel high. Someone will have those hangovers. If you took alcohol yesterday, you know what it means. You are waking up, you're having hangovers. You don't know. You don't even know yourself. You don't even remember anything that happened yesterday. There is increased blood pressure and of course heart rate. It is the heart will race very fast. You will know what's happening to this guy. This is not normal for people. There is also reddening of eyes. You will see their eyes are very red, and especially this area, the lower eye, it will be swollen. You will know there is something amiss. Dry mouth. They will have dry mouth, dry skin. Their skin will be like, the way someone glows. This one will be very dry skin. Even when they apply oil, they'll just look dry. Decreased coordination. They will just be talking nonsense, things that are neither here nor there. They are just there. They are talking things that are not known. They will have anxiety and paranoid. The paranoid is a situation whereby you think of something bad will happen. They are there. They have anxiety. They are anxious. They don't seem okay. They don't seem okay. even when things are quite okay. They'll have major cravings. These people were okay, you cook food, they eat very well, but now there are these cravings. They are craving of this drug. They want to take it more and more and more and more, you know. They want to take it. There is confusion. These people will complain of vomiting, you know. These are physical effect of drug use in excess. They will be violent. This was a dad, this was a mom. She was very caring, very good, very kind. This time round they change their characters. They start if it's a man, they will start beating their wives, arguing a lot, you know, seeing people that they don't wish them well, so they are quarreling all the time. You will basically know that something is wrong somewhere. Now their behaviors and of course symptoms that are visible, that you can see. These people will feel like using the drugs all the time. They want even to steal money so that they can have that satisfaction. You will tell. If it is driving, if it is something like maybe driving or doing some activities, they will do them speedily. They will just be at a very high speed. If it's driving, they will drive without even caring what it is, because they are under influence of the alcohol. So they are not thinking straight. Their concentration is of course altered. If it's a going school child, they will not concentrate in class, because there's no way you can sniff heroin or take heroin and then you're coming to class to concentrate. It doesn't work like that. Your concentration will be altered. You will not look okay. Most of the time you will feel like sleeping on the desk. Most of the time you will feel like surrendering. You will feel like singing. Yani you're in a restlessness situation. Spending money. Money is a barrier. It will tell you that there is something that is not going on. This person is employed, is earning money, or she is earning money, but you are not seeing the money. They are using the money to do drugs. You will know. They don't have money at any particular point, because for them, when they get money, straight away to drugs. You will know. They don't do any development. They have not done anything with the money. They have not bought anything tangible, you know. You will find out. You will know this person, there is something that is going on. And the earlier you find this, the better. Okay? Another thing is obligation at work or in school. They don't want to do their assignments. They don't want to do their homework. If it's at work, they don't want to finish the assignment. They don't want to attend any meeting. They don't want to indulge in anything. They just want to be left alone. And the major thing or symptom you will find is withdrawal. They will withdraw. They don't want to see anybody. This one will tell you that this is happening. Now, in my next video, I'll talk about treatment and of course how you handle relapse if it happens. How are you supposed to handle relapse? For those people who are already in drugs, there is something that can be done. Don't lose hope. Go to the nearest maybe hospital, or find a therapist, find a physician who can take you, find a counselor, find a psychologist who can take you through what you're going through. They will hold your hand until you stand. Maybe you will be taken to rehab, and avoid places that will make you go back to the same things. Try to avoid those areas. So it is going to be well with you, because majorly these drugs, they alter with your mental health. There is no way you can take alcohol or smoke or take heroin or take cocaine and be okay. Your mental health will be altered. It will be worse. In fact, it will land yourself into depression, stress, and these mental disorders. You will have them. And there are those people who think that if I do heroin, if I do drugs, if I do alcohol, if I do this and that, I'll be okay. I'll be able to combat the mental illness that I have. Or maybe I have depression, or I have stress. If I do this, I'll come out of this stress. My friend, wake up. It will make you worse than you think. Don't indulge yourself into substance substance abuse, because it will make your situation worse. Treat your depression. It is something that can be treated. Treat your stress. There are things that you will do to help you. Guys, this is the message I had for today. Make sure you look out for my next video, because I'll be talking about treatment and how to handle relapse. Okay? All is not over yet. There is a light at the end of the tunnel. Don't give hope. There are so many people who are affected worldwide on substance abuse. Don't lose hope. You are not alone. Okay? I will let you know how to come out of it a winner, powerfully. Okay? I have a website. Visit my website at themindtalkshow.com. You will find all my videos. You will find all my stuff there. Go visit and have a look. Okay? I wish you well. Bye bye.